Appleton itself is surrounded by nature, surrounded by great opportunities for getting outside and grounding yourself in nature, and then kind of tying that into treatment. One of the techniques that we teach to patients within mindfulness is grounding. And so I think that us incorporating that theme into treatment, and when people walk in the door, they're getting that feel of, this is an exceptional place, I'm going to receive exceptional treatment and care here.
We have on our wallpaper, we have some of that nature theme all the way down to our carpeting, wanting that kind of stone, that grounding, and even all of our pictures throughout the clinic are that nature feel, really hoping to just make that peaceful environment where patients can feel at home, feel that tranquility as they're working on their treatment-specific goals.
For every patient that walks through our doors, they're connected with a multidisciplinary team. They have a clinic assistant that's meeting them right away at the front to greet them, a therapist and a behavior specialist to help guide their treatment, a psychiatrist and a nurse for medication management, and a care advocate. And all of us work really closely together to make sure that we're meeting their individualized needs. We're creating a treatment plan that's unique to them, and we're making sure that, most importantly, we're meeting the patient where they're at.
And here we have our sensory room, the space where patients can take a self-care break.
Our clinic hosts a variety of different programs. We offer programs for adults, children, ranging from partial hospitalization, so 6 hours of programming Monday through Friday, to intensive outpatient, which is 3 hours of programming, also Monday through Friday.
When outpatient therapists have patients that are needing a higher level of care, they can come to our day treatment, our partial hospitalization, our intensive outpatient, and they can get those services to get back to a spot where they can be managed at that outpatient level of care without needing to go to inpatient. And on the other end, when we see people going to inpatient, we know they're going to do best and have the best outcomes if they can have a gradual step down, gradually getting back into their daily routine, and that's what they can do here at Rogers.
It really, in the Appleton area, stands out because we're able to offer that specialized level of care that a lot of other agencies just don't have, with that emphasis on those specific diagnoses that make a difference.
We run an AM program as well as a PM program. So maybe people are struggling with the AM time for whatever reason. They have to get their kids to school, or they have some other obligations during the daytime that they can't commit to our AM program, so that leaves the PM program as an option for them.
Our largest programs are our mental health and addiction recovery, which specifically in this area is very underserved. And so I'm really proud that Rogers is able to offer that to the community here. Too many times addiction is addressed and we don't address those other co-occurring disorders. And so I think being able to have somebody come in and talk about, yes, I need to stop using substances, but I also don't want to get out of bed, or I don't want to go out in society because I'm anxious, and being able to offer that specialized focus on those along with the focus on recovery from substances is really the top notch. I mean, that's what needs to happen.
We're treating the whole person, not one thing at a time. Instead of having to do one specialty program, then another specialty program, we can really get at everything when the person needs it the most.
One of the great things is when we have patients that take the time to reach back out to us and say, hey, I just want to thank you, I'm doing so well. And we've had a couple of those patients send us a letter and just tell us, you know, that they never thought that they'd be able to do this, and how they are starting to piece their lives back together and being successful, and that they associate that with Rogers. That is what fills your cup. Makes it all worth it.